Hi everyone. So very good morning to all of you. And
Good morning, everyone.
we are very happy and excited to meet you every day in the morning. So first of all, we express our gratitude that giving us a chance to be a part of your life every day in the morning.
Absolutely, yes. It's always a pleasure. And as I say, connecting with young minds, people who are aspiring to do something is the best thing to start your day with, right? So we're always happy to, speak to you right in the morning because it fills us up with energy.
And I would want you to give us a quick thumbs up if you're able to hear us and see us on the Damsey Medicos app and as well as on the YouTube channel. Give us a quick thumbs up so that we start with a very interesting topic for the day. The topic that we've decided for the day is me and Dr. Deepti were discussing that suppose me and you are discussing an MCQ and we want to, make sure that we remember it for life. We want to practice active recall. How should we go about it? Especially like suppose you and your friend are discussing, how should you discuss it that makes it more impactful, that makes it more recall worthy? So
The
today
way
we are
doctor, yeah, before we tell them what it is, very often, students come up to us and say, I study with my friend or I study in a group. And I would always tell them, that when you're studying with your friend or in a group, don't study theory. Right, because जब आप theory पढ़ रहे होते हो, then you are actually it's not a symbiotic relationship. एक जना हमेशा पढ़ा रहा होता है और एक जना हमेशा सीख रहा होता है. So I always say whatever you want to do, if you want to do a group study or a study with a friend, it should be something more which is more active between the two of you, and this is what we're going to talk about today, right?
So what we are going to do today is I will now ask Dr. Deepti to give us an example, or maybe I can start and then we can do it together, and we will
Okay.
all do it together. The idea that we have today is called as a reverse trick, the MCQ reverse trick. This is how we will build up the active recall. So I want all of you to keep this, keep a pen or something in your hand and be in the chat box, and I'll ask you a question. The question I want to ask you is: suppose the answer to your question in the exam is subdural hemorrhage. The example, the question, there is an image-based question in your exam. The answer is subdural hemorrhage. So you have to tell me what should be the other choices in the same question. So we are going to reverse method. We're thinking like an examiner. I'm sure you heard this line from all the toppers. Think like an examiner. Think like an examiner. So how does an examiner think? The examiner is able to do that. If the answer is subdural hemorrhage, what will be the other choices? So now we know the other choices have to be extradural hemorrhage, like a lot of students are writing in the chat, subarachnoid hemorrhage, and maybe uh, intraparenchymal hemorrhage or a basal ganglia bleed, some kind of a brain hemorrhage. So now you're thinking like an examiner that if the question is on a brain hemorrhage, all the choices have to be brain hemorrhage. Now I want you to construct the question. If the answer is subdural hemorrhage, what should be the age of the patient? What should be the age? What will they write? Will it be a young patient with a motorcycle accident, or do you think it will be an old patient? Do you think it would be an old or a young patient? Anyone? So now when you reverse engineer, and the entire idea is now you're both discussing, you and your friend, your buddy, your girlfriend, your boyfriend, whosoever you want to study with and get a great rank, now you're discussing. अरे यार अगर subdural होगा ना, they will ask a old person in the question, because in the old person the brain atrophies and that puts a blood vessel under tension. Which blood vessel will they mention? Anyone? So now we are thinking in a reverse mechanism. Then the answer will be bridging veins. Bridging veins. And do you think it is going to be a big injury or a minor fall? It will be a minor fall. And I'm sure you saw this question in the last year's NEET PG. Old patient had a minor fall in a bathroom, comes to the hospital with the CT scan showing. And what will the CT be showing? Will they show a CT or a MRI? Most likely in trauma, they will show a CT scan. And what will they show on a CT scan? They will show you biconvex or concavo-convex. Concavo-convex hematoma. And hemorrhage will look more white than the brain parenchyma or more dark. More white, we call it hyperdense. Now I have in front of you reconstructed the entire question, image, choices, and you thought like an examiner. Now you will never get this question wrong. This is just an example. I asked Dr. Deepti to give another example on it.
Right. Are you all ready with me? Okay. So let's see if I am playing this with Dr. Sumer. What are the things that I'm going to ask, and then how will I lead from four choices to one choice? And then me and Dr. Sumer will tell you what exactly we were doing. Right. So my first query to all of you is you are going to get a question on serum HCG levels, right? So now you are going to think if it is serum HCG levels, what could be the four choices, right? So can I say one of the choices can be ectopic pregnancy? Okay. Then I will say maybe one of the choices is abortion. Then let's say one of the choices is molar pregnancy, and then maybe choriocarcinoma, right? So, these are the four important places where there is value of doing serum HCG levels. Now, if I have to talk about ectopic, if the answer is ectopic, think of what the keywords or what the MCQ will have. Will it be early pregnancy or second trimester, first trimester or second trimester? So we all know if it is ectopic, it is going to be a patient with first trimester. If it's choriocarcinoma, it could have been a post-delivery patient also, post-suction evacuation patient also, a second trimester patient also, right? So if it is ectopic, the patient would be in the first trimester. Anything else that you can tell me? Can I say the patient is going to come to us with bleeding? Yes. Right? So maybe the question is patient is in the first trimester and she has come to us with bleeding. Now, madam, it could be abortion also. So now let us think what would be the hint that they will give us if the answer is ectopic. Can I say she is going to come to us with pain other than bleeding? Yes. So the patient is going to come to us with pain. But still, we are going very close, you and your friend. Yes. Now, still, it is not going to be something about ectopic pain, bleeding, first trimester. ऐसा क्या लिखें that the question is more on ectopic? So can you tell me? Maybe the examiner will say you have done a ultrasound. And Dr. Sumer, if I send the patient to you and if it is ectopic, what would you tell me in the report?
I will definitely tell that uterus is empty. There is an adnexal
Yes.
mass. There's
So
fluid
look
in the
at
pouch
the
Douglas.
keywords. This is what has helped me differentiate ectopic from abortion. Sir said the report is empty uterus. If it is abortion, there will be something inside the uterus. Then sir said there is empty uterus and complex mass. Now we are even getting more close. Yes. And what could be the more clinical type thing? I would say there is empty uterus, there is complex mass. What is
Blood in
your
the
next
pouch Douglas.
step?
And
Yes. So Dr.
there
Dr.
could be
Sumit says correlate clinically, but we are clinicians. We are going to do what we need to do. So what will we do? We will send serum HCG levels, maybe serial levels, maybe a single level helps us. So do you see what we have done now? Dr. Sumit, what have we done? We have done a reverse engineering technique where through a active discussion or an active communication, we have figured out keywords for a MCQ or a topic. What will happen is these keywords are going to resonate with you when you read the MCQ and they help in application. मैं हमेशा बोलती हूँ identify keywords, put them together and then apply them. Yes, what do
I'll
you
give
say?
you one more example. I'll give you one more example and then I'll include Dr. Deepti into it. Let's
Oh
see.
God. Okay.
Suppose the answer to the question is now all of you in the chat box will reverse engineer this question. The answer to the question is duodenal atresia. Answer to the question is duodenal
I'm
atresia.
also writing down. See, I have a
Yes,
pen
yes,
and
yes.
I have my notes.
Dr. Deepti, I'll have a question for you. Don't worry. I'll have a
So I'm
question in
writing
this
down.
topic.
I'm writing down.
Yeah. So if the answer is duodenal atresia, what are the other choices you expect in the question?
Can I
Anyone in
answer?
the chat box?
Can I
No, wait,
answer?
wait. Yes, Dr. Deepti, I know. But other choices would be maybe congenital hypertrophic pyloric stenosis,
Maybe
yeah,
tracheoesophageal fistula or a posterior
Pacemaker,
that.
any other bowel condition. If the answer is duodenal
Okay.
atresia, definitely they will put pyloric stenosis as one of the choices. Now we go back to the question. What will be the age of presentation? What will be the age of the baby? It will be a newborn. Newborn. Day one presents. Okay. Okay. Newborn and day. Okay. Second question. Any one of you can answer. I'm sure you can. That what will be the vomiting like? Bilious or non-bilious? What will be vomiting like? Bilious or non-bilious? Okay. Now we know newborn with day one bilious vomiting. And what will you show on a X-ray if I have to make an image-based question? If I have to make an image-based question, what will I show on the X-ray? Okay. The X-ray will show gas in the stomach, gas in the proximal part of duodenum. So you will see only two gas bubbles, no gas beyond that. That is called as the double bubble appearance. Now, suppose I want to integrate with OBGYN. Instead
Yes.
of the newborn, we will diagnose in the antenatal ultrasound. And then, Dr. Deepti, what will you see on the antenatal ultrasound?
Again, we are going to see the double bubble sign, right? So
Anything
we'll see
to
double,
amniotic fluid?
and I will make it even more clinical now. Suppose Dr. Sumir already tells me I am seeing double bubble, right? Which is what we were starting with, duodenal atresia. Maybe we want to know what else does the baby need evaluation for?
Yes, that is
Yes?
what I'm coming to. Now,
Yes.
the question actually is what else or what should you look for in such a baby? Anyone? What?
Can I answer? Can I answer?
Yes,
We should be looking for trisomy 21,
Down
right?
syndrome.
Yes, Down syndrome. So duodenal atresia has a very strong association. So any fetus who's showing double bubble must be evaluated for trisomy 21. And then you can keep adding keywords. What will we do to diagnose it? Right? Should I do AFP levels or should I do karyotyping? So AFP levels से कोई फायदा नहीं होगा ना. We already know it's duodenal atresia. AFP levels will be raised. पर मुझे तो association चाहिए. So then
Now,
a
what
better
happens is
answer.
now what we wanted to give you as an idea today is that there is a limited amount of things that you can retain when you keep doing the same thing again and again. Suppose I'm always reading again and again the same thing. It kind of mind can also get fatigued out, bored out, and the active recall suffers. And the
Yes.
correct method is to play with yourself. When we play and we do something new, like we're doing something new today in the YouTube, we are enjoying ourselves. Similarly, when you do something new for yourself, you enjoy yourself. And that new is reverse engineer the question. Now, when you and your friends are sitting together, then you will give each other a choice. Like, for example, I am now giving you the answer to the question as okay, I'm giving you a challenge now. Create a integrated question on extradural hemorrhage, connecting it with anatomy. Okay. Now, this is like a reverse engineering. You have to create the MCQ. I am giving you a buzzword, extradural hemorrhage, and I want you to create it with anatomy in the picture. Anyone? So you will say which blood vessel ruptures? The answer is middle meningeal artery. That's correct. But I want to integrate deep with anatomy. So I'll say which foramen. So, which foramen does the artery which is ruptured, through which foramen that artery enters the skull? Which foramen? So now extradural, the artery is middle meningeal artery. Which foramen? Foramen? Anyone in the chat box? Foramen spinosum. Or I might ask, the artery which is ruptured is a branch of. Artery which is ruptured is a branch of. So artery is middle meningeal artery. It is a branch of internal maxillary artery. And internal maxillary artery is a branch of external carotid artery. So now what we are doing is we are doing a reverse engineering based on a topic and a theme. Or you can do a reverse engineering with a buzzword. Like for example, suppose this is snowstorm. I'm saying snowstorm so that Dr. Deepti is involved into the discussion. Snowstorm appearance. Now create MCQ if the question is saying snowstorm. Dr. Deepti.
Okay, if it's snowstorm, I will give you a hint that on examination, the fundal height is 16 weeks, but the woman is only 10 weeks amenorrhea, right? Then maybe I can give you a further hint. It is snowstorm, but I don't see any cardiac activity or fetus. Yes, and then maybe I could ask you what is the karyotype. So, the entire purpose is that snowstorm, fundal height more, no fetus, we are talking about complete mole. Then, हमने लेकिन पूछा क्या? What we have asked you a clinical thing, but it is a one-liner. What is the karyotype of a complete mole? So we all know it's 46XX. right? So please understand, with the reverse technique, you can actually get better with all kinds of questions, whether it is a one-liner, whether it is a factual, whether it is integrating basic sciences with clinical sciences, or it is a horizontal integration. So we can do both, right? Like we were doing integration with radiology and obs, that's horizontal. Now you do it, sir was doing it with radio and with anatomy, that's vertical integration. So this is what is also the current pattern of the exams. And before Dr. Sumer
Yes.
wants to say something, I can see that. This is the entire planning and technique how we do revision at DAMS. So whether it is DAMS DBT or it is going to be upcoming DAMS DFX, right? Or it is INICET revision sessions, our entire purpose is to help you do active recall, right? That is why we always want you to have some FIVs or fill in the blanks. We want certain parts to be filled up with the students. We want you to form those neuronal connections which will help you in reflexes, which because there should be at least 50 to 60% of MCQs in the paper which you were able to solve only as a reflex answer. You didn't have to think a lot. कम से कम 50% MCQ ऐसे आपको आने चाहिए. So that gives you confidence, that builds up your basic score as well as helps you in time management.
Now you can even, act like an examiner and, create a twist MCQ. Like, for example, you have to now tell each other, how will we make a tough question on subdural hemorrhage? So we talked about subdural. I want to make a very tough question on subdural hemorrhage or put a twist. So now what you'll do is, so far I've told you, subdural hemorrhage will appear hyperdense. Any brain hemorrhage will appear more white than the brain parenchyma. What if they show it as dark? That becomes a last year's NEET PG question. Old man had a minor fall 4 weeks back, and they showed a subdural, but it was appearing dark. Now you have to think like an examiner. So you have created a twist that it is a subdural that is every year asked, but they're showing it dark because with time the hematoma, the clot will liquefy. Now the answer will not be an acute subdural; it will be a chronic subdural. So I hope this gives you the idea. Now you become your own enemy. You introduce your own twist. When you introduce the twist, now when the examiner will introduce the twist on the day of the exam, you will not be surprised. You've already seen it.
Yes.
You already know the game. You know that he's playing a game. And once you know it, you will always win. So it is always a good idea at even if you are at a formative stage or near the exam stage. It could be used as a method of revision. It could be used as a method of concept building, even after a single topic. Even if you're a first year MBBS, second year MBBS, third year MBBS, intern, post intern, appearing for NEET PG, appearing for USMLE, this technique works. You go in a reverse engineering method to start at the choice and think what the question will be. In the exam, it will be so easy because the question is already there and you know the game. You know the drill.
So, every day in transform session, we want to do different things for you. Some days it is how to make strategy and how to plan your studies. Some days it is specific to an exam, what you should be doing. Some days it's motivation. And some days it is just various techniques that can build you up into a better person. Right, so this was today Dr. Sumer's idea, and he's the idea man for us. He always has some brilliant ideas. And we'll keep coming back to you every day in the morning at 10 a.m. for these transform sessions. Today, I want you to write in the chat box as well as maybe later in the comment section, are you enjoying the Transform with Mentor Duo series? Right? So do let us know. Your feedbacks are important. You can even in the comment section write what you want the subsequent transform sessions to be on. Yes, because I keep getting these, ma'am, please isse kar do, please talk about this. So we'll be happy to know what you want us to talk about in the upcoming sessions. Please do make it a point that you go to the comment section today and tell us about whether you are enjoying the Mentor Duo sessions with Transform series or not.
And I would also request that if you can share the link of this video with your college groups so
Yes.
that they can also benefit from the discussions. And we'll be tomorrow talking about the topic that we have thought about for tomorrow is we'll talk about silly mistakes and the pathogenesis of silly mistakes.
Yes.
So that
Perfect.
if we know the pathogenesis, we will know how to crack it. So tomorrow, be there at 10 a.m. We'll talk about pathogenesis, etiopathogenesis, and epidemiology of silly mistakes.
And
And
obviously,
let's
how to
figure out
tackle them, therefore.
and how to tackle and how to. So once you know the pathology, we'll go to the treatment also.
So take care, everyone. Have a wonderful day ahead. We enjoy being with all of you. Lots of love and good wishes to everybody.